Hey everyone, welcome to another episode of Vital Stories. So आज के हमारे जो गेस्ट हैं, she is a practicing psychiatrist. So please help me in welcoming Dr. Nikita Achar from GMC Chandigarh. So moving ahead, Dr. Nikita, before going in the nitty and gritty of the things, can you please introduce yourself a little bit, your background and everything?
Sure.
Yeah.
I'm Dr. Nikita Achar. I'm a consultant psychiatrist, and currently I'm working on my own platform. It's called DNA Mental Health and Wellness. So it is an online platform where anyone with any mental health issue across India can reach out, and from diagnosis to treatment to therapy to general mental health advice. It is a single platform that delivers all of this. So yeah, that's about me. I did my MBBS from KMC Mangalore and went on to do my specialization in psychiatry from GMC at Chandigarh. So that gave me the advantage of understanding both North and South India, and understanding the cultural differences and all of that. So I decided to come up with a platform which reduces stigma related to mental health and makes mental health available to all and matter to all. So yeah, that's about my platform.
Okay, fair enough. We will be just segregating the whole conversation into two parts. The first will be for the MBBS graduates, and then we will be talking about, mental health issues.
Sure.
Right? So, talking about the domain psychiatry, abhi ke liye, matlab, why did you choose psychiatry?
So now that I think of it, I think a part of me was always intrigued by the human mind. It's, I think, the most complex thing to exist on this planet. Something that's, जितना आप समझो उसको उतना ही और समझने के लिए बाकी रहता है. So I think I was somewhere secretly always inclined to it. And I think internship really helped me understand that I was really interested in, understanding more about the human mind, why, emotions are the way they are, why people behave the way they do, that aspect. And because it really helped me to understand from, the basics, because as a doctor, you go through all the subjects and then you do get that opportunity to choose the one subject that stands out. So for me, it was psychiatry. Yes, it was.
Okay. And, moving ahead, there's always the curiosity in the mind of the students, and not specifically MBBS graduates, but for the others also. What is the difference between psychologist and psychiatrist?
Okay, so psychology and psychiatry are very interlinked, but they're not the same. Psychiatrists, you have to do your MBBS in India, definitely, and then you can specialize and do MD in psychiatry, and then you become a psychiatrist. And we are registered with the State Medical Council, so we are answerable to like the NMC now since 2020. But when it comes to psychologists, they would have done their bachelor's and master's degree in different courses in psychology itself. And to become a licensed clinical psychologist, you have to do your MPhil from an institute which is recognized by RCI, or Rehabilitation Council of India. So where a psychologist basically looks into administering certain tests and doing certain parts of evaluation, which is very, very important to even the treatment process. They also take part in therapy. They do initiate and continue therapy sessions, but a psychologist is per se not allowed to give any form of treatment, that is any pharmacological treatment to a patient.
Okay.
And a psychiatrist, based on what their training has encompassed, definitely we look into the treatment part. Some institutes also train psychiatrists to be able to do certain basic therapies or certain advanced therapies also. So that is different. A psychiatrist can do therapy and do the treatment part too, or can also rope in a psychologist to do the evaluation and therapy part. But a psychologist is not allowed to do the treatment part of it. Can advise and counsel, but cannot give treatment per se. So that is the main difference. And all patients should ideally first meet a psychiatrist.
Okay.
So that the initial screening is done, and then a psychiatrist might refer you to a psychologist or even a psychiatric social worker. So they these three individuals usually work in a team and make sure there is a holistic approach in treatment of the patient. So that's the core difference. Yeah.
Fair enough. And after the differentiation, if we talk about the scope specifically related to psychiatry, what do you think 5 years, 10 years down the line, what will be the scope of psychiatry?
So already psychiatry is a very upcoming branch. I think COVID period was a very good point, where everyone realized that mental health is actually very important. Everyone was dealt to, stay with their issues and learn to deal with it. And, a lot of hidden issues came up. So ever since that, I think people even using social media are now more vocal about mental health and related issues. So what used to be more stigmatized previously is now coming more in the open. So yes, I think psychiatry per se has a lot of scope in the time to come in India, that too.
Okay. So, talking about the scope only, I was just going through the statistics recently, and there was a report of WHO which states that, in the upcoming time, the people, will be having more mental issues rather than going with the, physical well-being in terms, going with the scope and everything. But still talking about MBBS graduates, they have very least preference going with psychiatry. Do you think so? Is that happen?
No, I honestly think it is an individual choice. Many people are opting for psychiatry. Uh, it doesn't even just depend on what rank you've got. Even the ones who actually have gotten a good rank are now picking up psychiatry because, one, it's an interesting subject. Two, it ensures work-life balance, which a lot of people are looking for now because people have started prioritizing their own mental health, and medical school is not easy for anyone. I think MBBS is, it teaches students well enough that it's going to be a tough journey ahead. And specialization or residency in any field is actually very strenuous, and it takes a lot of time and effort. And, even after that, the journey is not over yet. So a lot of people do prefer to take psychiatry up, from what I understand. And yeah, I think it's a very personal choice. I don't think people are not opting for psychiatry. From my experience, a lot of people are actually opting for it.
Okay. And talking about, in terms of colleges, which is the best college for psychiatry in India?
This is a very controversial question that you've asked, Ankit. But I think there's no one right answer, to be honest,
Mhm.
because it's a very subjective choice. I remember in my time when I was choosing, the subject and the place where I wanted to do it, there were a lot of things that came into my mind. It was not just the subject alone. I
Okay.
think every MBBS student or graduate, by the time they've come to internship, they don't usually have one single option in their head. They have two or three options in the departments that they want to be in. But there are a lot of factors that guide one to decide whether or not to pick up a psychiatry seat in a particular place. Okay.
Okay.
So what I can do is I can tell you what guided me,
Mhm.
which might actually help, those MBBS students who are watching this video now. First is you have to see what actually suits your lifestyle. You can't compare कि उसने ये seat ले लिया इस rank पे, so even I should take up this department, I should take up this institute. No. Um, put in your, absolute effort in finding out more about which institute you want to go to, which city it is in. So if you're someone who likes to be in a city that's well connected, has a social life that provides, you don't want to go to a remote place. And then already, like I said, residency is very stressful a period of time. तो उसमें भी आप कहीं गांव में जाके काम कर रहे हो, you're not going to be happy. So if that city thing is an important factor to you, then you should definitely take that into consideration. You need to see if work-life balance is important to you, and if it is, then you have to choose accordingly. You can't go to a really high stress department and expect that you will be able to pursue. It is possible, I'm not saying that it isn't, but then your expectations need to be realistic. And particularly with respect to psychiatry, one very important thing that everyone needs to keep in mind is language,
Okay.
because a lot of history taking and talking to the patient and connecting with the patient, everything is through talking. So if you are not comfortable with the local language, it does come in the way of your learning. It does come in, it's a barrier.
Okay.
So if you're thinking of going to some other place and you pursue psychiatry there, this is one thing you definitely have to take into consideration. Most important, no matter what, if you don't have interest in psychiatry as a subject and you're just doing it for work life balance या कुछ specialization करना है तो कर लिया,
Mhm.
it is not going to sit well with you because it is a very deep subject. You have to really have the interest for it, and you have to have a lot of patience for it. So I think these are the factors, make a pros and a cons list. And, the weightage should depend on what matters to you more. There's no one skill that you can follow. And at the end of it, let that guide you to decide which subject you want and which place you want. And then you can make your list accordingly. I think that would help you more.
Okay. But talking about your journey, what were the factors which you considered while selecting the colleges? Specifically talking about GMC Chandigarh.
Um, I had done my homework. I did speak to people inside the institute, the ones who had, who were doing their SRship or who were doing their residency at that time.
Mhm.
And so I found out more about, what are the work hours like, what is the workload like, how much, how is the work culture in general, how's the teaching there, what is the exposure, is there adequate exposure to, even learn more about individual subdivisions like, child psychiatry or addiction medicine or geriatric, you know. So I wanted that exposure, and I wanted to be in a city which is beautiful, encourages my hobbies, because I for me, work life balance was extremely important.
Okay.
And I heard really good things about GMC Chandigarh. So in my time, I opted for that. That was it was, I think, the first thing on my list at that
Okay.
time. Yeah.
Okay. But Dr. Nikita, what happens is talking about the other domains also, no, specifically surgery, talking about the Central Institute as well. I have been in discussion with many of the medical fraternities, and what their observation is, talking about the surgical branches, they prefer, going with the Central Institutes is not a good option. Rather than the state colleges would be a preferred choice for them as compared to going with the institutes. So do you think, talking about the psychiatry also, is it the same with the central and the state universities? Or is it like okay with the both the things? Either you go with the AIMS or you go with the, state colleges.
Uh, I would say that, see, definitely if there are central institutes and they are
Mm.
higher up on a list of, good colleges, then
Okay.
yes, if you're looking at a certain subject and, you're getting that college, I think you should go for it. Okay, if it, again, like I said, you have 10 things that matter to you, if it is satisfying even 8 out of them, you should go for it.
Mhm.
But uh, let me just tell you one thing. You will find teachers who teach well in places. You will find people who you don't benefit much from. You will have to do your own homework. You have to do your own research, and you will have to do your own, you have to put your own effort also. You can't bank on the institute entirely to be really good at, your field.
Mhm.
So definitely see if the exposure is there, if there are opportunities there, if there are devices or there are instruments that you can work with, and there's adequate exposure. If that is there, then that's a bonus.
Okay.
Definitely, you can compare and contrast it with other institutes and see if that opportunity is there or not. Because
Okay.
at least if the opportunity is there, you can train yourself on it, or with
Okay.
the guidance of one person, or one person who has at least used it. Maybe that, yeah.
To be precise, since you are opting it, you have done it from GMC Chandigarh, right? Let's say if any of this medical student is there, he has both the choices of going with the PGI Chandigarh as well as GMCH. According to you, what would be the better choice from him, from his perspective, him or her perspective?
Ankita, I'll not be able to answer this, to be honest,
Okay.
because I have, my own experience at GMC at Chandigarh, and I have
Okay.
not had the opportunity to, go to PGI Chandigarh. So
Okay.
it will be very unfair if I answer this question and then compare and contrast the two. I can say
Mhm.
that my institute was very good. It gave the exposure that I needed,
Okay.
and yeah, I benefited from it. I do attend conferences at PGI, and I do understand that more or less, the teaching is comparable in both the places.
Mhm.
Yeah, the workload is more in PGI from what I understand. So the work hours might be more there as well. So if
Okay.
that is something that you don't, you think that that will come in the way of your peace of mind, or you want a little more balance,
Mhm.
then I think GMCH would be better.
Good choice. Okay. Okay. Talking from the monetary perspective, who makes more money, a psychologist or a psychiatrist?
You are asking me one controversial question after another. Um, I would say that whoever the patient trusts more in a private practice, that
Mhm.
person makes more money.
Okay.
Because there are different scales that are there. Some do pro bono. Some have a sliding scale system. Some have, some charge by the duration. Some charge based on the kind of visit, whether it's an initial visit or a follow up. Or so there are different fees for each one. And I have seen psychologists and psychiatrists charging similar amounts as well. But at the end of the day, it depends on the patient, whether the patient trusts you enough to, put that amount of money and still seek help from you. So in a private practice, I would say this. Yeah.
Okay.
It's
Dr. Nikita, you know what? Since talking about, I'm just comparing it with the other branches as well right now.
Hmm.
Let's say talk about medicine, surgery. Right now, even in terms of radiology, also people are opting for the interventional radiology after pursuing, radiology as well. So, is there any scope, going with the ahead with the psychiatry also, or is it like psychiatry is the end branch?
No, psychiatry is not the end branch. You can do fellowships, you can do super specialization, you can do a DN. And there are different further branches like child psychiatry, geriatric medicine, addiction medicine,
Okay.
forensic psychiatry. Okay, and there are lots of people who do run sexual marital clinics. So yes, there is more scope. If you want to acquire more skill sets, there are many options in psychiatry as well.
Okay. So, is it like going with the specific institute, or is it like these are the kind of fellowships only which students need to pursue after going with the psychiatry further?
You can do it from any institute. There's no hard and fast rule. Whichever institute provides these fellowships, yeah, you can take it up.
Okay, okay,
Hmm.
fair enough. And talking about, in terms of we have talked about fellowships and everything. Let's say if any of the MBBS graduate is there, he or she is willing to opt for the psychiatry also.
Mhm.
Talking about from the student perspective as well, because generally what happens is these days, if they are personally inclined towards psychiatry as well, but somehow or the other there is a sort of resistance in terms of the scope, whether it will be there or not, because generally even their parental pressure is also there ki, let's not go with the psychiatry because ek wo hota hai na ki dimag ka doctor kyun wo karna hai, let's go
Hmm.
with the other thing. So do you think, did you face the same thing ki yaar, or is it like ki psychiatry hai to psychiatry mein hi jana?
So fortunately, I had a very supportive family who told
Okay.
me, whatever you want, you take it up.
Mhm.
And I think what guided me more was I had seen mental health being stigmatized throughout, and no one wanted to talk about it. It was a taboo. So I think from very early on, I wanted to make mental health matter. First,
Mhm.
that. Yes, there were many people asking me कि इस रैंक पे तो आपको कोई भी ब्रांच मिल जाएगा, किसी भी इंस्टीट्यूट में मिल जाएगा, आप साइकाट्री क्यों ले रहे हो?
Mhm.
But I did it for myself, and I think at the end of it, I am, really happy that I took that stance for myself. So
Okay.
yes, it is stigmatized. A lot of people, even till date, one, they confuse psychiatrists for psychologists. That confusion will never go. But more than that, in the aspect that they don't even consider psychiatrists doctors, that is also there. But mind is one thing. मतलब शरीर का कोई भी part अगर काम नहीं कर रहा है, a person
Mhm.
can proceed. A person can still at least retain his or her individuality. But if you've
Mhm.
seen someone who does not have that mental capacity due to a mental illness, you'll see that the person does not remain that same person, at times. It is that vital an organ which basically takes care of anything and everything. And yet it is something that no one speaks about. You know, people just say, "Ha, it's okay. Uh, you know, it'll be fine. Just chill, just relax.
Mhm.
Don't be so obsessed with it. Just it'll go away. Just don't talk about it." So that
Mhm.
is the kind of response anyone gets when they gives rather when they talk about mental health issues. So I think it is extremely important. It is definitely upcoming, and soon there will come a time when people are fighting for psychiatry in radiology seats or dermatology seats.
Mhm.
Yes, that time is going to come.
Okay. Talking about mental health issues only, what do you think like talking about awareness, are people specifically or our generation, are they aware about mental health these days?
I think the awareness is on a rise. You mentioned, right, that WHO is giving statistics and saying that the number of mental health issues is going to increase.
Mhm.
I think a part of that would also be because more people will actually come forward with the mental health issues that are
Mhm.
there. I don't think there's a single person in the room who has not faced a mental health issue at some or the other point of time in their life. I don't think there's a single person. And yet the proportion of people that reach out for help is very, very less. So yes.
Okay.
Hmm.
Nikita, talking about from the, as we talk about mental health issues, I think that is a very wide term. अगर मैं उसको segregate भी करूं, talking about stress, anxiety and depression. what is the differentiation between these three terms?
Stress, anxiety. See, anxiety is basically बेचैनी होना, घबराहट होना. You get a lot of somatic complaints, matlab bodily pain, palpitations, headaches, lot of fear of something that's going to happen or that has not even happened. The excessive worrying or obsessing about things, these will come under the anxiety spectrum. डिप्रेशन इज मोर ऑफ मन का उदास होना, किसी भी चीज में मन न लगना, जो पहले जिन चीजों में पहले इंटरेस्ट बहुत होता था अब उसमें भी कोई कुछ खास इंटरेस्ट है नहीं. Attention concentration can get affected in both. So depression and anxiety are very, very closely interlinked. They have some common symptoms also. Like both of them will have some attention concentration problems. In both, sleep appetite gets disturbed. So there are a lot of things, but again, suicidal ideations can be a part of both, right? So it's very, very closely interlinked. Together, it comes under neurosis, right?
Okay.
So, but yes, they are very similar. I would say they're brother, sister. And
Okay.
usually if one is present while the other one is there, the prognosis gets a little worse. And the person needs, more strong treatment, and it's very difficult to treat in general.
Okay. And adding on to it, sometimes what happens is when people are sad, they relate it with the depression. Is it the same thing, or what are the differentiation factor in it?
Being sad is just one symptom. Okay. But depression is a lot of other things. And it is not ki ek baar sad ho gaye to depressed ho gaye. This term is used very wrongly many times. But, depression is more than just being sad. Depression is about having a low mood and not, finding anything pleasurable, feeling down for most duration of the day for many days together. And nothing is, interesting or exciting. And it is also associated with, like I said, attention or concentration problems. It is associated with a lot of guilt, excessive guilt.
Mhm.
And, feelings of, I am worthless, I'm useless, I'm hopeless, nothing can help me. And also with suicidal ideations. Matlab, any of these symptom domains may or may not be present. We definitely see the duration for which the symptoms are present and how, whether it is actually present for most day or not, and for, how many symptom domains are there in that individual person. And then based on that, we categorize it as, mild depression or moderate or severe depressive episodes. And kabhi-kabhi isme psychosis bhi ho jata hai, bahut severe hone pe. So we have a set criteria that if it is satisfied for that set duration, we call it a depressive episode. Sad is just an emotion.
Mhm.
Your emotions are always in response to either a thought or something someone has said or something that has happened. It's a natural physiological response to, something that has happened or something that's thought of, an internal or an external event. So
Okay.
being sad is not being depressed. But yes, if you're depressed, you're sad. It's,
ओके.
it's like
जैसे आपने साइकोसिस का बोला, साइकोसिस में क्या मतलब होता है साइकोसिस का?
साइकोसिस मतलब उसमें डेल्यूजन्स हो सकते हैं. मतलब एक फिक्स्ड फॉल्स बिलीफ जो कोई इंसान बहुत फर्मली होल्ड ऑन करता है जबकि उसके अगेंस्ट भी एविडेंस होता है. एंड इट इज नॉट कीपिंग विद द सोशियो कल्चरल बैकग्राउंड ऑफ द पर्सन. मतलब उस बिलीफ के अगेंस्ट एविडेंस होते हुए भी इंसान उसी पे यकीन करता है. मतलब हाँ कि वो मुझे मारना चाहता है. दैट्स लाइक अ
Is it a kind of illusion or something related to it?
illusion.
Illusions.
Illusion is very different. Illusion is actually to do with the perception. मतलब अगर बीच रात में आपको एक रस्सी, you mistake it to be a snake. That is what is illusion. So there's some stimulus, but you have perceived it wrongly. Hallucination is a psychotic symptom. Illusion is not a psychotic symptom.
Okay.
Hallucination जब कुछ होता नहीं है तब भी कुछ चीजें दिखाई दे रही हैं या सुनाई दे रही हैं. Those things. And it is not always we have to really see if it is a psychotic symptom or not based on many other things like duration and in which substance it has come, whether the person took a substance and uske baad usko hallucination ye hua ki nahi. So those things you have to see a lot of things. Then we say ki haan ye hai ki nahi hai.
Okay. And Dr. Nikita, based on your experience, अगर मैं एक लाइन में पूछूं, why depression happened, or why it happened?
So it is actually an interplay of biological factors also and environmental factors also. हेरिडिटरी भी होता है, जीन्स में भी मतलब प्रीडिस्पोजिशन होता है, अगर फैमिली में है यू नो हिस्ट्री ऑफ डिप्रेशन, तो थोड़ा सा लाइक्लीहुड बढ़ जाता है, मतलब इंसान वल्नरेबल होता है कि कभी जब स्ट्रेसर आता है तब वो सिम्टम्स उभर के आ सकते हैं, या डिप्रेसिव एपिसोड तब आ सकता है. एंड ऑल्सो इट इज एनवायरमेंटल, मतलब बहुत सारे एनवायरमेंटल फैक्टर्स भी हो सकते हैं, यू नो अब्यूज, चाइल्डहुड अब्यूज और सेक्सुअल अब्यूज और नेग्लेक्ट इन चाइल्डहुड, या मतलब इवन न्यूट्रिशनल फैक्टर्स कैन लीड टू डिप्रेसिव लाइक symptoms.
Okay.
And many other things are there. So substance use, all these things, whatever is triggered, matlab it's an interplay of just, there's not just one single thing. Sab kuch mil mila ke it can cause symptoms of depression. Yes.
Okay. And, based on my observation, I get to talk with a lot of people, specifically MBBS की ही अगर मैं बात करूँ, and जो मेरा experience भी है ना, अगर मैं depression से, because sometimes what happens is in terms of my जो friends हैं, families हैं, we also used to talk about it, specifically going with the current scenario. And जो मेरा experience है ना, based on my observation and understanding, व्हाट आई फील इज डिप्रेशन तब होता है जब सामने वाले को, जब उसकी मेंटल स्टेट में कोई चीज, कुछ ऐसा उसकी लाइफ में हुआ है वो एक्सेप्ट नहीं कर पा रहा. इज दैट सो? अगर मैं साइकोलॉजिकल पर्सपेक्टिव से भी पूछूं कि इज इट लाइक, क्योंकि देयर इज अ फ्रेंड ऑफ माइन, उनको मतलब वो ही गोन थ्रू दैट पर्टिकुलर फेज, and based on my observation ki because of career perspective he was not able to perform that well, and what happens is he get to a lot of things at that time. And what I concluded based on the discussion, it was like based on his particular experience, he was not able to accept the thing that okay, this can happen in his or her life as well. Do you think, is it kind of relatable to those people who are going through phase these days?
See, if have you ever noticed कि two individuals when placed with the same, when faced with the same situation can react differently?
Of
हो
course.
सकता है कि एक इंसान को डिप्रेशन हो एंड एक इंसान को सेम सिचुएशन में, सेम मतलब बिल्कुल अलग, कुछ नहीं चेंज किया बट उसको नहीं होता. सो दैट इज व्हाट, देयर आर लॉट्स ऑफ फैक्टर्स पर्सन टू पर्सन. Job might be important to you, it might not be so important to me. So the amount of importance we give, yes, anything can act like a precipitating factor, but वो इंसान के vulnerability पे depend करता है. एंड ऐसा नहीं होता कि मतलब हो सकता है कि उसी टाइम पे उसको 2-3 चीजें और मतलब उसके लाइफ में ऐसे हो गई जिसकी वजह से वो उभर के आया, मतलब ऑल हिज अदर सपोर्ट सिस्टम्स आल्सो फेल्ड एट दैट टाइम. So it's a very, very variable thing. But there are many depressive cases or depression cases that come where we cannot identify ki what was the trigger or what was the stressor. Ek din uthe, they're not feeling good, they feel absolutely empty on the inside, they don't feel like doing anything, they have all these issues, and then it stays for days together. So biological wale factors bhi bahut strongly play kar sakte hain, even without proper environmental stressors, ya hame dikhta nahi hai. So small very tiny traumas that we face can also compound and then lead to at one point it comes out.
Okay.
That can also happen, but yeah, it could be a precipitating factor, yes.
Okay.
But वही है कि अगर इंसान vulnerable नहीं था तो हो सकता है कि वो उस सिचुएशन को भी हैंडल कर सकता था.
And do you really think so, talking about the social media, is it also plays a crucial role? Because आज के टाइम पे सोसाइटी का वैलिडेशन होना भी बहुत जरूरी है, specifically talking about Gen Z. Do you think that also plays a very crucial role which led to depression?
Ankit, I think more than Gen Z, yeah, even Gen Z actually, but more than that, Gen Alpha has literally, this is the generation that has come into a digitally connected world. And मतलब उन्होंने बिफोर आफ्टर भी नहीं देखा है. मिलेनियल्स और जेनजी ने कहीं ना कहीं वो ट्रांजिशन देखा है ऑफ गेटिंग इनटू this social media coming up, or everything, this virtual reality, augmented reality, artificial intelligence. We have seen a before and after, but I think Gen Alpha and now Gen Beta that's going to start, these kids are going to be born into, or they are already born into, a very, very digitalized world. And yes, if a lot of importance is placed in the hands of social media for validation, it can affect a person's self-esteem जब उसको वो validation वहां से नहीं मिलता.
Okay.
So self-esteem might come down. Whether or not it directly leads to mental health illness, we have to again see a lot of factors and then decide.
अगर लेट्स से मुझे अगर चेक करना हो कि मुझे डिप्रेशन है या नहीं है, तो कुछ ग्राउंड रियलिटीज या कुछ पैरामीटर्स हैं जिस पे इंस्टेंट मैं अपने आप को जज कर सकता हूँ?
यस, हम नॉर्मली DSM-5 या ICD-11 को फॉलो करते हैं.
Okay.
So in that there is a set of criteria that is given, and it says that, you know, if you have these many criteria out of this for this duration, then you might have this episode. But again, it's always better not to take matters into your own hand. एक बार mental health professional से बात कर लो, because now everyone checks on Google or just, you know, checks on the net or even chat GPT and then decides, okay, do I have it or not? It's a good maybe screening tool sometimes if the correct information is fed into the system. But even if you have a doubt or you feel the need also, you know, even feeling the need ki, do I have this? Just, you don't have to meet a psychiatrist only when you've gone into the full blown mode. You can also see and, you know, have a, जैसे आप दांतों का चेकअप कराने जाते हो हर 6 महीने, you can get your mental health checked once in a while and, you know, just run it by a mental health professional. They'll guide you better.
Okay, fair enough. डॉक्टर निकिता, एक थोड़ा सिली सा क्वेश्चन है कि आपने डियर जिंदगी देखी है आपने?
जी.
So basically होता क्या है कि जो आलिया भट्ट है, she also, you know, went to psychologist, I would say.
Yes.
तो एक हमारे माइंड में एक इमेज वैसी भी होती है ना कि समवट अराउंड कि अच्छा हमारा साइकियाट्रिस्ट या साइकोलॉजिस्ट होगा तो वो शाहरुख खान टाइप्स फैंटेसी होगी कि वो हमें गाइड करेगा डे टू डे फिलॉसफीज. इज इट लाइक सो और इज इट लाइक कंप्लीटली डिफरेंट?
See, you do get guidance. I don't think Shah Rukh Khan or Kareena Kapoor milenge aapko, but yes, I think you will get the guidance you need. See, every person needs a different thing from the therapist. So, which is why, you know, one person will choose one particular person and another one will opt for another person. So, it'll not be as dramatic as portrayed there, for sure. But yes, it is a place where you can openly talk about whatever you feel like. It's a place where emotions are out in the open. Yeah. शाहरुख खान तो नहीं मिलेंगे आपको. उसके लिए उनको टिकट करना पड़ेगा.
ओके. सो अभी अगर मैं जैसे आपका एक्सपीरियंस की बात करें, जो कोई रिसेंटली मतलब हैव यू एवर सीन एनी सॉर्ट ऑफ एक्सपीरियंस व्हिच वाज लाइक वेरी मतलब आपके हिसाब से इट वाज वेरी हॉरिफाइंग और समथिंग लाइक कि ऐसा केस आपने पहली बार एक्सपीरियंस किया हो?
नहीं, आफ्टर सम टाइम हमें कुछ हॉरिफाइंग नहीं लगता है. See, what is portrayed in movies as mental health facility or the shock treatment and all of that, it is really hyped. ऐसा कुछ भी नहीं होता है. In fact, where I was doing residency, you know, initially we were all scared because we also had those notions that anyone has. But eventually you realize that they are human beings. We are here on this side today. Anyone can go to that side, you know, on any day. And there isn't much difference in behaviors as such. There's a very, very, very small percentage of patients who are actually aggressive or violent. Okay. And ऐसा नहीं होता कि दवाई मतलब काम नहीं करती या उनको मतलब अलग रखा जाता है या उनको चेन किया जाता है. None of that happens. They are treated like any other patient of any other department. So a lot of things have changed, and also Mental Health Care Act of 2017 has ensured that there is protection of rights of every person with any mental illness, even more. So जो आप मूवीज में देखते हो वैसा होता ही नहीं है. I'm not able to recollect which scene that was, but जैसे ऐसे मतलब आके बिना किसी चीज के ऐसे झटके दे रहे हैं या जो पागल पेशेंट वो दिखाते हैं, they are roaming around making noises, you know, making odd gestures, ऐसा कुछ नहीं होता है. In fact, if anyone goes and sees a mental health institute, they'll realize कि हाँ मतलब है कहाँ patient, मतलब इतना कहीं नहीं होता जितना दिखाया जाता है. And मतलब there's very, very good treatment meted out to patients now. And yeah, मतलब बिल्कुल ही फर्क नहीं होता है.
ओके. पर जैसे आप अपने कलेक्ट कर पा रहे हो थॉट्स, एनी चैलेंजिंग केस व्हिच यू केम अक्रॉस रिसेंटली?
No, I cannot recollect anything like that. Or what I think is challenging, it might just be a very normalized thing for me now. Maybe that's why I'm not able to tell. But yes, it is a little scary when someone has hallucinations in the beginning, I would say. I remember in my internship, yes, one patient who did have hallucinations, I did get a little scared. But you know, with treatment, once the hallucinations go away, it's absolutely like they're normal.
Okay. Moving ahead, talking about, let's say if any of the person is going through depression, right? So what are the bodily changes he or she goes through during his, depression journey?
मतलब from head to toe, any symptom might happen,
Mhm.
and you will not be able to guess that depression is leading to it. So
Okay.
absolutely anything can happen. A person might be, uh, getting just body aches, yeah, headache, yeah, might have, stomach disturbances, and will not understand ki kya ho raha hai, but it might be coming from, mood states. Or the person might just be having anxiety symptoms, chest pain, palpitations, या हो सकता है उसको उसकी मतलब सेक्सुअल प्रेफरेंस ही कम हो गई हो या सेक्सुअल नीड्स कम हो गए हो, डिजायर कम हो गया हो. इट कैन
Mhm.
कम इन द वे ऑफ the sexual needs, like I said. So yes, depression can cause any and every symptom, and like I said, in psychosis, तो अगर डिप्रेशन बहुत ज्यादा सिवियर होके साइकोसिस में चला जाता है तो इंसान को डेल्यूजन्स भी हो सकते हैं. देयर वाज वन वेरी इंटरेस्टिंग केस ऑफ दिस वन वुमन, elderly woman I had seen. She was in severe depression and she had psychotic symptoms. And because of just the depressive symptoms, she believed, मतलब वो इतना एडवांस हो गया था कि she started believing that her neck is made up of metal, and so she can't swallow food. And so she stopped eating. She actually stopped eating for many days because she would not believe us when we said that, no, you have a proper neck. There is a food pipe that goes, the food will go down. She would not eat. So depression can do anything and everything. In fact, so many patients have come with just bodily complaints, and मतलब उनके सारे रिपोर्ट्स ठीक निकलते हैं, सब कुछ ठीक निकलता है, बट एंड में डिप्रेशन कॉज होता है.
Mhm.
Because depression affects your sleep, your appetite, your concentration. It can come in any form, which is why we say that, even if you keep suppressing things to the bottom of your mind will only take it till it can handle. उसके बाद bodily symptoms आते हैं ज़्यादा.
Okay. So according to you, if we talk about age group, specifically आज के टाइम पे what are the general age groups की जिसमें लोगों को सबसे ज़्यादा डिप्रेशन हो रहा है? Is it like Gen Z only or is like old age people are also going with the same?
सारे एज ग्रुप्स में होता है, ऐसा नहीं है. मिडिल एज ग्रुप में ज्यादातर भी होता है. बट अगेन, अगर एक डिप्रेसिव एपिसोड आता है, द लाइकलीहुड ऑफ अनदर डिप्रेसिव एपिसोड कमिंग इज वेरी वेरी हाई. एंड उसका जो गैप होता है सीक्वेंशियली वो कम होता जाता है, विच इज वाई सीकिंग ट्रीटमेंट ऑन टाइम इज वेरी इंपॉर्टेंट टू अवॉइड द रिलैप्सेस. तो उस हिसाब से यस, इट मूव्स ऑन टिल मच लेटर ऑल्सो. बट वही है कि वो ज्यादा ज्यादा मुश्किल हो जाता है ट्रीट करने के लिए, स्पेशली इफ नॉट ट्रीटेड प्रॉपर्ली इन द बिगिनिंग.
Okay. So let's say अगर किसी पर्सन को डिप्रेशन है, राइट, एज अ रिस्पॉन्सिबिलिटी ऑफ हिज और हर फ्रेंड्स, सो is it something कि as a part of a support system his friends or family should do these are the steps so that उसको कम से कम anxiety हो, कम से कम वो depressed feel करे? Any pointers you would like to add?
I would say first thing is everyone in today's time should be updated कि mental health issues होते क्या हैं, उनके symptom signs क्या होते हैं, and how to reach help and when to reach help. Okay? And most importantly, if someone is seeking help or trying to seek help, stop making fun of them. Stop telling them कि कुछ भी नहीं है, you're making it up in your head, you're overthinking, don't do that, you don't need help. या वो पागलों वाले डॉक्टर है, तुम तो नॉर्मल हो, तुम्हें क्यों जाना है, तुम्हें अभी जरूरत नहीं है. Don't say these things, because first step is to always encourage the person, even if there's nothing and the person feels that there's some problem. The problem is not big or small, it needs to be addressed. And not just that it'll stop you from a mental illness, it'll help you function better in all your dimensions of life. So from that perspective, it's always good to get some clarity on about what's happening in the head, because like I said, mind बहुत ही ज्यादा complicated होता है. आपको लगता है ऊपर से कि आप इस चीज से डील कर रहे हो, अंदर कुछ और ही होता है. So it's very very important कि if you have that doubt that am I dealing with this, you should go and ask upfront, because social media, online platforms, they have so much information. उसमें कितना credible है कितना नहीं, वो सिर्फ डॉक्टर बता पाएगा. So very importantly, seek out proper information, seek out proper help. And if you don't know how to talk to a person who's dealing with any mental health issue, don't talk. Just take the person to the help. You don't have to say something negative if you don't have anything positive to say. I would say that.
But Dr. Nikita, why do you think is it a taboo in today's society also, specifically talking about metropolitan cities? Because generally what happens is, since I belong from a very middle class background, right, and talking about my surroundings, if someone goes through, some sort of, not specifically depression or any sort of stress, anxiety, people start claiming about this thing ki yaar use depression hai, he's going through this and all. Why this kind of mindset is there?
One is misinformation. Just
Mm-hmm.
like I said कि डिप्रेशन डायग्नोज करने के लिए एक सेट नंबर ऑफ क्राइटेरिया है, एक ड्यूरेशन है जो हमें पता है. सो जब लोगों को ऐसे दिखता है कि हाँ कोई रो रहा है, थोड़ा सैड लग रहा है, हो सकता है वो उस चीज को लेबल कर रहे हैं. अब ये डिप्रेशन हो भी सकता है, नहीं भी हो सकता है, कुछ और भी हो सकता है. सो वी आर sitting here to actually figure that out ki what is the person actually dealing with. And yes, it is, like I said, we are becoming more and more aware. And in fact, in this, Gen Z and Gen Alpha are better in certain aspects because we have started seeing the world as a very globalized platform. सारे आइडिया शेयर हो जाते हैं, इंफॉर्मेशन अवेलेबल है, रेडिली अवेलेबल है, बहुत ओपन डिस्कशंस होते हैं. वी आर नाउ ऑल talking about a more inclusive world. And because of that, people are also more vocal about their mental health issues. So that is definitely changing. Like I said, sometimes social media might also help you understand, I could be dealing with this. But the confirmation part of it should always be with someone whose credentials you have checked and who is a doctor and who is a specialist. So yes, there's a lot of work to be done. Even till date, even when I do go and give talks, once or twice I've even heard this being told that, I don't think I need the talk, I'm not mental. So that, and the talk was about something like, dealing with workplace burnout, which is something that everyone faces. But the second the word mental comes in the picture, they all get very defensive. Many people don't want to reach out when they're with their colleagues or, with their family members because they feel that they might be judged. But it is extremely brave to just step forward, honestly call out the symptoms that you're facing and seek the help. Because agar aap help seek nahi karoge, there are many people who come to us for mental health, information, or they want to know what's going wrong with them. But it is the people in their lives who are not seeking therapy or seeking help who are the real problem. And the other population turns up to us for help, the ones who want to improve and want to change. So if you're not seeking therapy, if you're not working on your own mental health, maybe because of you, someone else is dealing with mental health issues. So be mindful. Whether you're a parent, you're a sibling, you are a teacher, whichever capacity that you're in, if you don't understand something, feel free to, redirect them to a professional, but don't, discount someone's experience, is what I would say.
Okay. And अगर मैं एक rational perspective से भी पूछूं, let's say I am looking for a psychiatrist. How do I identify कि ये psychiatrist सही है मेरे लिए? Because generally, we have a lot of options. Since आपने बोला we live in inclusive world, right? And of course, we have a lot of information. In talking about digital era, we have access to everything, right? But वो identification की यार, this is the right person for me who can guide me. How to identify that?
See, it depends on what you're calling as the right person. If you want quick results, आपको आज ही want to turn over a new leaf, see, it doesn't work that way because psychiatric medications take longer time to work. And तब तक हो सकता है सिर्फ side effects आप महसूस कर रहे हो या experience कर रहे हो. So it takes a longer time to work and it is a continuous process. It is not about reaching a certain level and saying, okay, I'm done. Okay, it's about continuously pursuing an improved version of yourself, or a version of yourself that you understand better because you're more in sync with your thoughts and your emotions, and it is more under check. And because of that, your behaviors are more in your control and you are doing those things that you actually want to do, and you're not losing control over, your behaviors or your emotions or whatever. You're a better person in your own eyes. And so it's a continuous process. It is not something that's going to happen soon. So just because you didn't get immediate results, if you're changing your doctor or your therapist, I'll talk about doctors now because medicine is the doctor part, right? So if you're changing your doctors really frequently, then it's very unlikely you'll get any solution anywhere. बिकॉज जितने टाइम में उस चीज को काम करना था उससे पहले ही आपने अपनी दवाइयां चेंज कर ली और डॉक्टर भी बदल लिया.
Mhm.
But even same thing works in therapy also. Therapy
Okay.
is something that you have to continuously, implement the things that you have learned. First of all, learning it is a little difficult. Once you learn it, you have to incorporate it in each and every part of your life. And it is also about unlearning a set of behaviors you have learned your entire life up until now. So many years have gone into you becoming the person you are today, you having those behaviors, those thoughts, those emotions. To absolutely rewire yourself is going to take time.
Mhm.
And many people don't like the therapist they are with, because sometimes when you have to clear out all the you know dirt that was there somewhere inside, it becomes very very uncomfortable, and it is unpleasant, and you have to deal with your emotions that you normally don't want to deal with. So it becomes uncomfortable instead of being therapeutic or getting the reassurance you wanted, because it's a long process. And because of that, people might not prefer a particular therapist or a psychiatrist. But I would say that calm down a bit, have realistic expectations from your session or from your medications. It's going to take time. And also, what I would say is that if you're not comfortable still after that with your mental health professional, you can definitely try out another person, because like I said, each person is different. One mental health professional is different from the other.
Mhm.
Some have a certain skill set, another might have something different. Whatever suits you, you can choose that and stick to that.
Okay.
uh, yeah.
Fair enough. Since you have highlighted two things. One is the journal timeline, and another thing is side effects. What are the side effects, after taking the medication? Is it like some serious side effects happen when a person is taking pills or something like this?
So there are different side effects.
Okay.
Usually, we anticipate that in the first few days of taking the medicines,
Mm-hmm.
those side effects will come, because the body is basically getting adjusted to the medication that is there.
Mm-hmm.
And once the body is adjusted, then the therapeutic effect starts coming out, and the side effects will automatically decrease and reduce. So, what I do with my patients is I normally inform them beforehand that these are the different medicines that are there for the problem that you're dealing with, and these are the side effects. So, if we can anticipate, it's not that every person is going to experience those side effects. हो सकता है कुछ और ही side effect हो भी, but we will try to have a continuous open conversation, so that those side effects are monitored and they are taken care of time to time. So it can be very simple side effect like nausea or vomiting, to serious side effects also. But it is always informed, and it is nothing to worry about, because when it is done, when the medicines are prescribed, it is done in a very graded manner. We don't start at the highest dose. We always see which dose is perfect, or we can optimize it to the effective dose without much side effects. And also, there's always a solution for the side effects. So nothing that a person needs to not take medications for. Side effects to har cheez ke hi hote hain. But
Mm-hmm.
yeah, it should not come in the way of taking help.
And what is the journal timeline which any of the person is able to recover? Let's say he or she is going with depression.
So in psychiatry, in most of the disorders that are there, or illnesses that are there, recovery is mainly in terms of respite from symptoms
Mm-hmm.
and an improved quality of life. So it can be variable. Some people, it depends on how fast you have sought treatment also.
Mm-hmm.
So the earlier you seek treatment, the greater the chance that you will recover quicker, the greater the chance that you will probably require a very low dose of medicine to
Mm-hmm.
recover faster. And also, it's very different from person to person. So we see recovery in terms of respite from symptoms more than, so that those symptoms don't come in the way of a person's functioning.
Okay. And related to this only, let's say अगर मैं डिप्रेशन की ही बात करूं, सुसाइडल थॉट्स कब आते हैं? मतलब is there any kind of a stage जहाँ पे person goes through the suicidal thoughts as well?
See, suicidal thoughts, we usually talk in context of depression or depressive illness.
Mhm.
And what I would say is, if you are having suicidal thoughts, or you have made a plan also, a suicidal plan, or you have attempted in the past, it is a serious symptom. You should talk to a mental health professional, no matter what is the cause of the suicidal ideations. It is something that is a red flag and you need to address it immediately. अब सिर्फ डिप्रेशन में नहीं होते सुसाइडल थॉट्स, हो सकता है एडजस्टमेंट डिसऑर्डर में हो, बाइपोलर डिसऑर्डर में हो, सब्सटेंस यूज के बाद हो, या उस सब्सटेंस के इन्फ्लुएंस में इम्पल्सिवली कोई सुसाइडल अटेम्प्ट करने की कोशिश कर रहा है. तो देयर आर मेनी मेनी सिनेरियोज. It's just that it is a warning sign. If you have those suicidal thoughts or ideas, any time will be the good time, or any time as quick as possible is the good time to reach out to a mental health professional to at least just understand why you're having those thoughts, or to even abort the attack, because then we know that we have to have a plan in place. We need some medicine sometimes to take care of what is leading to those suicidal thoughts and ideations.
Okay. And Dr. Nikita, like, let's say if any of the person is going through the suicidal thoughts, right? So ऐसा क्या trigger होता है उनके mind में? Because I'm sure you must have gone through that thing कि जहाँ पे patients को आए हैं suicidal thoughts, right? So based on your experience and your observation, कि what was the triggering point for them? Is it related to, because there are different domains, right? Let's say talking about their personal life, their careers, their, anything, right? So what were the major things? Ki, is it like related? Because right now talking about the competition also, specifically हमारी generation में बहुत ज़्यादा है. And कहीं ना कहीं वो acceptance factor अगर नहीं आता तो that there, because since मैं जिस domain में हूँ वहाँ पे talking about from the competency perspective also, people go through that rough phase, going as aggressive as they can. Still they are not able to get the desired results. So what is your take on it?
Your question to me, can you just rephrase it again, if you don't mind?
Yes. Let's say if any of the person is going through a depression, right? So what was the triggering point जहाँ पे उनको ये, और because देखो suicide is very extreme step, right? उस extreme step को, because अगर मान लो उसकी लाइफ में कोई rough phase चल भी रहा है तो ऐसा क्या हो गया उसकी लाइफ में because he is ready to go that extreme level कि या उसे suicide करना पड़े?
So usually suicidal thoughts तब आते हैं जब ये ट्रायड हो. वर्थलेसनेस, कि मैं बिल्कुल किसी काम का नहीं, ऐसे जब थॉट्स आते हैं. दूसरी चीज होपलेसनेस, कि मेरे फ्यूचर में ऐसा कुछ भी नहीं है जो वर्थ इट है फॉर मी टू प्रोसीड विद दिस लाइफ. एंड हेल्पलेसनेस, कि कोई मेरी मदद नहीं कर सकता. यूजुअली जब ये तीनों का ट्रायड होता है दिमाग में, that is what usually pushes a person to have suicidal thoughts and ideas. Like I said, usually, because there can be a lot of things. It could be just an impulsive decision also. So many people who absolutely look fine, who have probably felt fine also, as an impulsive act, they do, take part in suicide. But usually when these thoughts, these negative derogatory thoughts about yourself or your future or the environment, ki हाँ कोई help नहीं कर सकता, I'm in a very horrible situation, there's no hope for me, I am useless also, ये जब दिमाग में चलता है, it usually does give rise to suicidal thoughts, because you feel like that is the end point of anything and everything.
And इसके अंदर do you think spirituality and meditation also help?
I think each his own. If spirituality is helping you, you should you should consider it. Meditation, personally, I think is a very, very effective tool to, one, understand what's going on in your head. So many times we're stuck in this hustle culture, हमें पता भी नहीं होता कि हमारे दिमाग में कौन से thoughts घूम रहे हैं, why those thoughts are there. Those thoughts are very important because they keep influencing our emotion, they keep influencing our behavior. But वो thoughts घूमते रहते हैं, and इनमें से कुछ thoughts बिल्कुल बकवास होते हैं, baseless होते हैं, and they also will be controlling our emotions and behavior somewhere. And only some thoughts are there that are worth paying attention to. So when you are constantly aware कि आपके दिमाग में कैसे thoughts चल रहे हैं, you will then be able to properly screen and filter out कि हाँ, this is a useful thought and this is just a negative automatic thought that's coming in my head, but it's still having some weightage on my mood and how my day is going, so I don't want to pay attention to this. And it helps you be very mindful. It helps you can be मतलब जो mindfulness वाले techniques भी हैं, in which you view your thoughts without being judgmental and you're grounded to the present. It helps you be more efficient in a certain way, because जब आप past में या future मतलब past की चीजें उस पे ज्यादा ध्यान दे रहे हो या future को लेके ज्यादा concerned हो, over worry कर रहे हो, it basically does not let your prefrontal cortex, which is like the part of the brain that controls all your executive functions, it does not let it do its, due diligence, planning, organizing, thinking, all those things. So all the executive functions will come to a hold because हमारा दिमाग overwhelm हो जाता है कि हाँ कुछ नहीं हो पा रहा, right? But if you're in the present and you're grounded and you understand what's happening in the present situation, you'll have a more of problem solving approach rather than, being very anxious and not being able to do anything.
ओके, सो अभी जैसे आप बता रहे हो कि आपका जो लाइफस्टाइल है इट्स वेरी हेक्टिक एंड ऑल, एंड जब आप इतने नेगेटिव चीजें देखते हो, हाउ डू यू कीप योरसेल्फ वेरी काम, वेरी पॉजिटिव कि यार ठीक है, लेट्स गो थ्रू इट? बिकॉज आई एम श्योर कि केसेस आते होंगे वेयर देयर आर वेरी एक्सट्रीम की होपलेसनेस है, बर्थलेसनेस है, तो हाउ डू यू कोप अप विद इट?
I think we have our good days and bad days also, to be honest. And I guess a part of us also understands the limitations of the field कि हाँ हम इस हद तक मदद कर सकते हैं, उसके बाद हो सकता है कुछ चीजें हमारे कंट्रोल में ना हो. And I think we just end up doing our best. We also have to take care of our own mental health, definitely. So I do practice what I preach. I follow this mantra in my head that I have to try and do. It's okay if I don't do it also on some days, but I have to try and do 3 things in the day. One, something for my mind. It could be, just a 5-minute guided meditation or some mindfulness practice or anything, something that calms my mind and something that lets me feel grounded and aware of my day and gives a pause in my routine. Second, I do something for my physical health. So any activity. It could just be a 15 to 20-minute activity, or it could, on days that I can indulge in more, I do. And some days are absolute rest days. I do nothing. Third could be something that I do for the soul. So something that's fun, something that's new, that that I'm intrigued to, or something that keeps me going, because you should have some amount of fun, right? So
Correct.
These 3 things I personally did so because I did face a lot of pressure in my residency. We had long work hours, our sleep routine was not good, and it did affect my health in a certain way. So then you start realizing that, okay, even we need to start incorporating these things. And it's very difficult to be able to do everything, but you do need to take time out for your mind, body, and also your soul, is what I would say. Everyone needs to, especially doctors, because even if you try not to be stressed out, our circadian rhythm is absolutely disrupted. हम सोते नहीं हैं, खाते नहीं है time पे. So these things will definitely affect both our mind and body. And ऐसा नहीं होता कि उसका aftermath नहीं मिलेगा हमें, वो तो आता ही है. But yeah, I think all doctors should definitely set boundaries, take care of themselves, because एक point आएगा जब your mind and body might not be able to take it. So start implementing this. Need not be long and elaborate. Just 5 minutes a day will also help a lot.
Okay, so moving ahead to one of the most contentious thing, because हमने देखो जैसे डिप्रेशन की बात करी, अगर मैं बात करूं आज के टाइम पे ड्रग्स की, because right now it is one of the talk of the town. Specifically drug addicts are the people, not specifically, अगर हम हर डोमेन में भी देखें तो there are people who are going through that rough phase. तो जो एज ग्रुप है, क्या मतलब आपके एक्सपीरियंस और आपकी ऑब्जर्वेशन क्या कहती है कि आज के टाइम पे हाउ बैडली इट इज अफेक्टिंग आवर यूथ?
It is there, I will say. Substance abuse. See, there are lots of addictions, not just substance addiction, but even behavioral addictions like internet addiction and gaming. So there are lots of things that are there. It activates the same path in our brain, if you will know. So a person who's smoking versus someone who's addicted to the net, the same pathway is activated, and it is very, very prevalent in some or the other form. Because it is something that once you get into, initially you do it for the pleasure of it. कि हाँ अच्छा लग रहा है, मजा आ रहा है, right? But then what happens is you start using the substance or indulging in a behavior only because अगर आप वो नहीं करते हो तब आप uncomfortable feel करने लगते हो. So initially you do it to get pleasure, and later on you do it to avoid the discomfort of stopping it. So it is a vicious cycle a person gets trapped in. A lot of us are, addicted to different things. But yes, it is very prevalent in today's time.
ओके। डॉक्टर निकिता, यू नो व्हाट, मेरे मामा भी जैसे डॉक्टर हैं, एंड यू नो ही इज अ प्रैक्टिसिंग सर्जन, एंड यहाँ पे नियर बाय वी हैव वन ऑफ द यूनिवर्सिटी, वन ऑफ द रेनाउंड यूनिवर्सिटी, ओपी जिंदल यूनिवर्सिटी इज देयर, एंड उनके पास बहुत सारे केसेस आते हैं इसी चीज से। एंड वो मुझे एक चीज कहते थे कि यू नो जो केसेस उनके पास आते हैं ना, दे आर वेरी एक्सट्रीम्स, मतलब ही यूज्ड टू डिस्कस विद मी, एंड उनका ये भी मानना था कि अगर मान लो किसी से तुम्हें दुश्मनी करनी हो ना, तो जनरली लोग क्या करते हैं कि दोस्ती करी एंड ड्रग्स की आदत लगा दो,
Hmm.
his life will be hell and his life will be finished. ऐसा होता है।
I have not seen it firsthand, but yes, definitely there might be people who are promoting substance use for their own ulterior motive.
Okay.
But yes, which is why it is very important for everyone, especially I would say that this is probably more prevalent in the rural background, जहाँ लोगों को पता नहीं होता है, and they just indulge in using a substance on 2-3 days, and on the 4th day जब उनको तोड़ लगती है and उस substance के बिना उनका नहीं हो पा रहा, then they are brought to de-addiction centers. So yes, there might be people out there doing it, which is why awareness about this ki even using the substance for a few times can lead to very very big problems. That information is not there. So usually even when patients would come to me in de-addiction centers, they would say that they didn't know, they just started it, and on the 4th day when they didn't take it, they had body aches, they had if opioids, if they take opioids, then they had so many severe withdrawal symptoms. They would have watering of eyes and naak beh raha hai. They have loose motions, uncontrollable loose motions. They have terrible body aches that they are not able to control. So they're not able to sleep because of the pain. So at that point, a person is latched onto the drug, and for no fault of theirs usually, because initially either they just wanted to try it once, or they were basically introduced to that substance without full knowledge of it.
Okay.
So yes, that does happen, which is why I think awareness campaigns are very very important. उनको एटलीस्ट बता दे कि हाँ, इतना मॉनेटरी लॉस भी होगा, इतना आपके हेल्थ पे भी प्रभाव पड़ सकता है इस चीज से, एंड आई थिंक देन एटलीस्ट द पर्सन विल बी एबल टू मेक एन इन्फॉर्म्ड डिसीजन कि हाँ, मुझे फिर भी ट्राई करना है।
ओके। एंड टॉकिंग अबाउट जितना भी ये मूवीज में दिखाते हैं, ये स्पेसिफिकली अगर मैं उड़ता पंजाब आपने देखी होगी, एंड संजू इज वन ऑफ द मूवी जहाँ पे संजय दत्त का पूरा वो जर्नी दिखाई हुई है। तो जैसे जो फिल्मों में दिखाते हैं, इज इट लाइक जितने भी ड्रग रिहैबिलिटेशन सेंटर्स भी हैं, टॉकिंग अबाउट फिजिकल अब्यूज, बिकॉज वो तलब लगती है, तो इज इट लाइक कि वहां पे होता है फिजिकल अब्यूज भी होता है इतना एक्सट्रीम कि जस्ट टू मेक देम कंट्रोल, इन टर्म्स की मारा जाता है कि टॉर्चर किया जाता है, फिजिकल टॉर्चर, कि जस्ट बिकॉज कि तुम्हें वो रेजिस्टेंस अवॉइड करने के लिए, ऐसा भी होता है?
You're saying to overcome the withdrawal symptoms?
Yes.
No, that is not the way we would advise, because see, it is something that is happening because of activation of pathways in our brain. We are almost helpless. We are like puppets us point pe, right? So see, the only one thing that's actually wrong in this is basically the doing wrong part is unpe hai जिन्होंने ये शुरू करवाया after having full knowledge. So the ones who are making others do or resort to substance use, knowing fully and knowing well ki aise outcome hoga, they are the ones that we need to stop. But the ones who have taken a drug and now they are in need of help, no, we don't resort to physical abuse or violence of any form in de-addiction centers. Okay. In fact, everything is very regulated. उनका बायोमेट्रिक लिया जाता है, they're registered on the portals, government portals, so that we understand कि किसको कितने we even regulate कि किसको कितना medication मिल रहा है in de-addiction or in de-addiction basically, and that is given in a regulated manner. They are called for follow-ups. They have to come in person themselves. Their relatives can't take the medications on their behalf, and especially initially hum har 2 ya 3 din mein unko bula ke we see if the symptoms are under control. Okay, so there are 2 different types of detox and de-addiction that you would say. One is the detox part, wherein we absolutely get the person off the substance. तो उसमें अलग ट्रीटमेंट होता है, उसमें मतलब डी एडिक्शन सेंटर में यूजुअली भर्ती करके वी गिव सपोर्टिव ट्रीटमेंट, यू नो, लाइक आई सेड दोस सिम्टम्स, सिम्टोमेटिक ट्रीटमेंट हम दे देते हैं। बट अगर बहुत ज्यादा क्रॉनिक यूज की हिस्ट्री होती है, आईवी ड्रग अब्यूजर्स होते हैं, उनको मतलब बहुत ही ज्यादा तलब लगती है, बिकॉज ऑफ विच दे अगेन स्टार्ट यूजिंग इलिसिट ड्रग्स। उससे बेहतर होता है कि हम उनको मेडिकेशन के साथ, जिसमें थोड़ा सा परसेंटेज ओपियोइड होता है, एंड बट उसको मतलब वो एक तो उसमें और कोई मिलावट नहीं होती है, दूसरी चीज उसको जीभ के नीचे ही रखा जाता है, एंड दे कैन नॉट इंजेक्ट दोज ड्रग्स, दोज विल नॉट वर्क इन दैट फॉर्म। बट small amount of, you know, that particular drug, it's basically reduced to a point where उनको तलब भी नहीं लग रही है, but उनको withdrawal मतलब वही withdrawal symptoms नहीं हो रहे, but उनको craving भी नहीं हो रही है कि मैं substance use करूं।
Okay, okay.
और balance is struck.
ओके, फेयर इनफ। एंड देखो, मैं अगर अपने, बिकॉज मेरी कॉलेज लाइफ के दौरान आई हैव बीन टू पंजाब दिल्ली, कि वहाँ पे आई हैव सीन पीपल हु हैव बीन रेगुलरली यूजिंग द ड्रग्स। एंड हमारे कॉलेज में क्या होता था, लाइक सब चलता था, हैश, कोकेन एंड ये सारी चीजें। एंड देयर वाज वन मोर थिंग, स्नेक बाइटिंग आल्सो, यू मस्ट हैव हर्ड अबाउट इट। It is also one of the kind of drugs people take it. And I met one of the person over there, and he often take it. And I just asked him, why do you take it? What sort of pleasures do you get? And he was like, उसने एक चीज बोली कि it was a escape zone for me.
It was an escape zone.
Escape zone. कि just क्योंकि अब देखो, and he was like कि यार हर किसी का एक escape zone होता है, किसी को सोना पसंद है, and तो मेरे लिए it's a kind of high. And do you think कि जो बंदा डिप्रेशन में है, अगर वो बंदा इन सब चीजों में भी जाता है, मतलब इज इट लाइक कि जस्ट बिकॉज ऑफ टू अवॉइड ऑल दोस थिंग्स, कि हाँ उसे रियलिटी से दूर रहना है?
एक्चुअली बहुत सारे लोग जो सब्सटेंस यूज करते हैं उनको अंडरलाइंग डिप्रेसिव या एंजाइटी डिसऑर्डर होता है।
ओके,
सो most often than not we have to explore that very importantly. If someone is coming to us with substance use, we first definitely elevate their symptoms and we reduce their symptoms, but uske baad we do explore and see ki what was the real reason why the person started using drugs. हो सकता है नॉवेल्टी सीकिंग बिहेवियर हो, या हो सकता है एक्चुअल में डिप्रेसिव या एंजाइटी सिम्टम से बचने के लिए उन्होंने स्टार्ट किया। तो उसको जब हम ट्रीट करते हैं तब ऑटोमेटिकली सब्सटेंस यूज भी कम हो जाता है।
ओके, ठीक। अभी जैसे देखो, जो हमारा भी यूथ भी है, टॉकिंग अबाउट द लास्ट क्वेश्चन फॉर द डे, व्हाट वाज द फाइनल एडवाइस यू वुड लाइक टू गिव टू आवर यूथ
अबाउट मेंटल हेल्थ?
अबाउट मेंटल हेल्थ।
Okay, if you're dealing with any mental health issue at any given point of time, आपको समझ में भी नहीं आ रहा है कि am I actually dealing with an issue or not, don't think twice before actually reaching out to a mental health professional. Don't stop others from reaching out to a mental health professional. Now mental health is cool. Looking after it is cool. It's trending. So hop on to this trend. And it is, don't go by movies, don't go by what you've seen. The scary picture of psychiatrists and mental health issues, utna nahi hota, kuch nahi hota aise. Educate yourself, be aware ki kya ho raha hai actually, what is the reality of things, and yeah, have a good time. Look after your mind and body, very very important.